Valentine's Day is tomorrow and love is in the air. It's a holiday that's more than just chocolate and roses.
Did you notice her emphasis on tomorrow, Josh, her husband? Our medical expert, Dr. Payal Kohli, joins us this morning to discuss how a healthy relationship can benefit your physical health as well. Good morning, Dr. Kohli.
Good morning, guys.
And happy early Valentine's Day.
Thank you. Same to you.
So what chemical changes are we talking about that happen inside your body when you are in love?
It's incredible. You can actually feel your heart rate go up, and that's cortisol. So when you first fall in love, you actually have higher levels of the stress hormone, but they work in a good way. And then as you sort of get more connected, you release oxytocin, which is the bonding hormone that we release also when we're nursing, and dopamine, which is the same hormone that triggers a reward center. So being in love is actually the equivalent of sort of winning the lottery, so to speak.
Oh, I love that's a really good way to look at that.
Yes. Now, I'm sure does it work the same way if you're in a bad relationship?
Exactly. So a bad relationship can have really bad effects on your health. And that's the whole point here, which is that if you've got these positive stress hormones and a positive reward hormones, it can really help with your blood pressure, help with your longevity. But if you're in a bad relationship, it can actually chip away at those. And so Valentine's Day is a time to sort of sit down and assess a little bit to your relationships, whether it's romantic relationships or social relationships, and really focus on the nurturing ones.
Yeah, absolutely. And I like that you said it's like winning the lottery because, Caleb, if you're watching, you're so lucky to have me, right? It's all luck, right? No, I'm just kidding. Now, is it actually being in love or is it the social connection of it all?
You know, we actually think it's both. It's the physiologic changes that happen with it, because if I showed you a picture of your partner, Corey, if I showed you a picture of your husband, it would actually trigger a center in your brain that changes your sensitivity to pain. It changes your mood. And so that's very interesting because we see those on MRI findings. But we also know that the social connectedness, the network, the support. So there's a very famous study by the American Heart Association that people who've had heart disease, if they're unmarried, their risk of having another heart attack or dying is 52% higher.
Whoa.
Yes, than people who are married. And part of that is the social support as well as, of course, we know when we're in a relationship, we take better care of ourselves. We have somebody that holds us accountable. So we think it's actually components of both. But the important message here is that it doesn't have to be romantic love. It's really any type of connectedness, any type of network, whether that's parent and child, whether that's galentines and a friendship, anything that really helps you feel like you're part of something bigger can trigger those changes.
Whoa, okay, so Valentine's Day, you obviously think of your heart health. What are some tips that we can do to take care of our heart?
Well, you know, I think this is really a time we talk a lot about exercise and diet and blood pressure and cholesterol. We cannot forget about social connectedness. Yeah. So it's a time for us to reach out to those that we love if we haven't in a long time, because that's not just good for them, it's good for us. Yeah. As well. And it's really a time for us to focus on the fact that these types of relationships can help us live longer, lower our blood pressure, improve our insulin sensitivity, improve our mood and our energy on a day-to-day basis.
I remember we were talking to you about this during the pandemic as well, of course, whenever that was a lot of forced isolation, given the circumstances, what was going on. But a lot of people's physical health, they didn't know why it was declining if they were in isolation. And now we know we need that specific social connection, and not just virtually. We need to actually physically be around people.
Very much so. And in fact, if you hold your partner's hand or anyone's hand, that physical touch actually reduces the fight or flight response. And they've studied this. So those chemicals that get triggered when we're anxious or stressed can actually go down with a physical touch. So I think reaching out to people and connecting with them, it's the ultimate gift that we can give to anyone, not necessarily flowers and chocolate, but more physical connection and emotional connection, because it's good for our heart, it's good for their heart, and we can really change how we interact with each other if we think about Valentine's Day with that context.
See, that's why Josh is giving you a hug for Valentine's Day. He said, I'm just doing it for your health.
Yes,
exactly.
Totally. I'm so glad we talked about this ahead of Valentine's Day. Yeah, those friendships are so important, relationships. Dr. Kohli, thank you.
And don't forget, you can find all of Dr. Kohli's appearances at 9news.com/Dr. Kohli. Let's get a check.